this amazing guest that we have. So Joanna Doran is a cancer rights attorney. She's an author, she's a speaker and CEO of Triage Cancer, a national nonprofit organization providing free education on practical and legal issues that may impact individuals coping with cancer and their caregivers. She has spent more than 30 years working on behalf of individuals with cancer and has represented nearly 1,000 educational seminars on employment, healthcare, insurance, and advocacy issues throughout the country. So she truly is an expert in this space. We are so grateful to have her joining us today. Joanna, thank you for being with us.
Thank you so much for having me. I'm happy to be here.
Wonderful. We know that this is a really important topic and one that I'm sure you hear so often is so stress-provoking and anxiety-provoking. So as we start this conversation, I thought it would be good about kicking off with just sharing some of your best general tips for managing medical bills in general.
Well, I think the most important tip about managing medical bills is not to ignore them. Because even though there is a feeling that some people have that there's no possible way that they can actually pay their bills and that they'd rather just not even bother opening the mail, that's actually the worst thing that people can do, because there are some ways that you can manage your bills and actually get help. But if you ignore them and you don't pay them and you don't tap into those tips, then your bills are likely to be sent to collections and you lose so many options available to you at that point. And so we want to make sure that people are really making sure they're looking at their bills and seeing what they can do about them, because there are some potential strategies.
That's great. I think sometimes, we have that out of sight, out of mind. I know I certainly am guilty of that. So I think that that's a really good reminder for all of us.
Yeah, avoidance coping, while it feels maybe the way to handle it in the moment, definitely isn't the way to handle medical bills. So we want people to be able to use some of the things that are out there to help them.
Good. Okay. Anything else?
I think it's also important for people to stay organized about their medical bills. Bills generate either a lot of paper, or in some cases it's coming as emails, or maybe people have access to online portals from their insurance company or even their providers, and that's how they're getting the information. But keeping it organized and keeping track of things is one way to effectively manage medical bills so that you can tap into all the things that we're going to talk about today. And even if you feel like you don't have the energy or you don't feel well enough to do that on your own, this is a perfect example of where you can tap into family and friends for support. Because even if they're just literally opening the mail and pulling out the pages and discarding the things that you don't need and keeping the things that you do, and matching up your bills to the explanation of benefits from the insurance company, that's actually a pretty useful step to take to stay organized. And it's the first step in managing medical bills.
And I'm glad you mentioned that explanation of benefits, because I feel like sometimes maybe we think that that isn't necessarily a paper that we need to hold on to or we need to keep track of. So you're saying that we do want to keep that EOB handy and partner that with the bills. Is that a good form of organization?
It is. In fact, it's actually one of the most important pieces of the medical bills conversation. So when we talk about getting paper from insurance companies and providers, insurance companies might send us letters that say things like, "We've received a claim from your provider." And then they might send a whole nother letter that says, "We're processing that claim." But the most important piece of paper that you're going to get from your insurance company is that explanation of benefits. It's also called an EOB, and it looks something like that chart. So it has information on it that has, what your provider billed for something, the service you received, what you are responsible for paying. But somewhere on there, it says this is not a bill. And that's actually a key piece of information, because you don't pay your explanation of benefits. It's really just an explanation of how your insurance company handled the claim from your provider. And that's really important, because you want to Maybe they didn't pay for the claim at all. Maybe they said, we're not paying for this, and now it's all of your responsibility. Or maybe they're not paying as much as you thought that they were going to pay for that bill. Or maybe you just want to make sure because it looks like you're going to pay a whole lot more than you were expecting. Medical bills is a human process. And so even when we're using computers and we're typing into computers, typos exist. So you
All the
always
time.
make sure that they're actually correct before you pay them. And the explanation of benefits is the piece of information that you want to double check and compare it to the bill that you get from your provider and make sure it's correct.
I love that piece of advice. And certainly staying organized, I would imagine, can really help keeping the two together. I know one of the questions we had from our audience was, how does someone just keep up with all of these incoming bills? But like you said, sort of finding a personal method of organization that works for you and pairing them up can really help to keep things organized.
Exactly. Whatever, if it's file folders, if it's a 3-ring binder, there's online tools, whatever organizational method works for you is one we encourage. And I'll just give you an example of why it's so important to actually look at the EOB and compare it to bills. So I went to, a number of years ago, an annual visit with a primary care physician. And I knew that based on the law, that primary care visit should have been at zero out-of-pocket cost to me. So I shouldn't have had to pay anything, not even a copayment. And then I got a bill from the provider for $1,000. And at that point I had a heart attack. And then I, paused for a minute. And I'm like, wait a minute, I shouldn't have to pay this. What could I have possibly misunderstood about this situation? And sure enough, I waited for the explanation of benefits to come. The insurance company paid for the visit, and I didn't know anything for the bill. But if I hadn't waited for that piece of information and I had just paid the bill thinking that I was responsible for it, or figured out how to pay for the bill, like trying to get financial assistance or all the other things that people do when they're in a situation where they can't afford to pay a full bill, then I would have had to be in a position of getting that money back from the provider because I didn't actually owe it to the provider. And we really want to help people try to avoid that situation and to not have to feel like they pay bills that they're not responsible for.
Absolutely. What a great example to share, because we've all been in those situations where you get a bill before you get the EOB, right? And you just think right off the bat, you have to pay it. And then again, that feeling of like, how am I going to afford this? What am I going to do? So, wow, what a great example to share. And so it really is best, I would imagine, until you have both pieces of paper handy so you can do a little compare and contrast.
Exactly. And sometimes people get worried and they think, well, my provider's going to send me to collections before I get the explanation of benefits. It's unlikely to happen, but if someone were concerned, they could absolutely call their provider and say, look, I'm waiting for my explanation of benefits. So can you push back the due date on this bill? Like, I'm working on it and I'm going to get back to you, but I want to make sure I get that piece of paper first.
Good. I love that suggestion. That's that, to know that that is always a possibility is a good thing. And I would imagine that, your billing office at the provider's office is probably just appreciative that someone is reaching out and saying, I got this. I just need to do a little bit more digging versus ignoring it altogether.
Exactly. And that's part of proactive work that you can do that you can't do if you're ignoring the medical bills.
That's right.
That's why it's important.
Okay. So speaking of proactive and sort of keeping track of medical bills, should we be keeping track of how much we're spending or the bills that are coming in? Like, do we need to know the total balance that we're paying or that is due? Is that a number that we should, keep pretty current?
It can be very helpful for a couple of different reasons to keep track of what you're actually spending out of pocket. The first reason is that for most people, you have an insurance plan that has an out-of-pocket maximum, meaning there's a cap on how much you actually have to pay out of pocket. So it's a good idea for you to keep track of what you're spending out of pocket to make sure that when you reach that cap, you don't keep paying out of pocket. Now, some insurance companies are better at actually putting that piece of information on your explanation of benefits, like where you're at in reaching your deductible or your out-of-pocket maximum.
Right.
But this is another good example of where you might be paying more than you need to, because if you've already met your out-of-pocket maximum for the year and you walk into a doctor's office, for example, and they ask for your copayment, if you've already met your out-of-pocket maximum, you might not owe them a copayment. So that's a situation where you might have to be getting that money back from the provider, as opposed to saying, I've already met my out-of-pocket maximum for the year, but if you would prefer, you can bill it to me after the visit. And in most cases, they're not actually going to bill it because you've already met your out-of-pocket maximum.
Okay, that's really good to know. I never knew that copay was even, there was even a possibility that you didn't have to pay it right then and there. I'll be very honest with you.
It really, I mean, it depends on your plan and what the rules are and what contribute to your out-of-pocket maximum. So some employer plans won't include deductible or copayments in your out-of-pocket maximum. Like marketplace plans, for example, that they're required to include all of that in your out-of-pocket maximum. So you have to know how your plan works, but keeping track of what you're paying can help you avoid overpaying. And then the other piece is that might be tax deductible. So the information or the expenses that you're paying for your medical and your dental care might be tax deductible if you are itemizing your taxes. So it might actually lower what you pay for your taxes at the end of the year, or you might get a bigger return back. So there's actually a financial incentive to stay organized and keep track of your medical bills.
Yep, and that is a compelling argument. I think anytime that we could say like something is tax deductible or it may positively affect us at the end of the year is always something good to know.
Yes, and certainly helps address the overall problem with the fact that there are medical bills and you have expenses. Right. So keeping track of, the money and maximizing the money that you do have is always useful.
Yep, absolutely. So what if someone has received a medical bill and it says that their insurance isn't covering a particular procedure or test? Then what are some options for a patient to do?
If an insurance company is saying that they're not going to cover care, and that might happen before you receive the care, or it might happen after you've received the care and then you get that explanation of benefits and that's where you find out that they're not going to cover something.
Okay.
That's actually pretty common for insurance companies to deny coverage, whether it's a prescription drug or surgery or a particular treatment. They deny care. So it's important for you to know what to do in that situation. And depending on the type of health insurance coverage that you have the right to appeal that denial. If we're talking about private insurance, where someone gets their insurance through an employer or an individual plan, like a marketplace plan, they not only have the ability to appeal that denial to the insurance company directly, called an internal appeal, you also have the right to an external appeal, where you get to go outside of the insurance company to an independent entity, and they get to decide whether or not the care that was prescribed by your healthcare team is actually medically necessary. And if they decide that it is, then your insurance company has to cover it. So it's an incredibly useful consumer protection that was created both under some states and then also under federal law. So every state is required to have an external appeals process. And this was created in the Affordable Care Act as federal law. So we've had it now for more than a decade, but no one knows that the external appeals process exists. And I don't
I'm sorry, go ahead.
Either.
So where does someone go to find the external appeal phone number, point of connection to get that process? Is that something that is listed on their medical bill, or is it state specific? Like if someone wanted to take this action, where would they go?
So it does depend on the type of health insurance plan that you have, but it should be on the denial. So when an insurance company provides the denial, they're also supposed to provide the instructions for how to appeal. Based on our experience, it's not always done in a way that's super obvious or easy for people to understand, or sometimes even correct. And so if anyone has questions about the external appeals process, we have a lot of resources on appeals on our website at triagecancer.org. But you can also always go to your state insurance agency and start there, because when you tell them that you want to file a complaint or file the external appeal, they'll provide instructions on where you go next. Some cases might happen at the state level. Some cases, based on the plan that you have, it's actually run by the Department of Health and Human Services at the federal level.
That is wonderful. And I know that we will put your website linked in the chat for those that are following along. But I will also reiterate, Triage Cancer has a ton of resources. So if you have not already checked out their website for the different handouts and different sections and information to share, tip sheets that they have available in English, even in Spanish. I've recently connected or shared some with our Spanish members. It's a wealth of information. So definitely check out their website for sure. I'm glad you mentioned that, Joanna. We did get a question sort of in this vein from one of our members. So this person asked, drugs for stage 4 breast cancer are costly. Wondering how people manage to shift from Medicare when Part D does not cover many of the needed drugs. Can you comment on that at all?
Yeah, so I think I would start by talking about Medicare Part D. That is the prescription drug coverage available through Medicare, but it's actually run through private insurance companies. So when you buy private Part D coverage, those plans are deciding what gets included in the formulary or the list of drugs covered by that plan. And generally speaking, they are required to cover certain categories of drugs, but you might be taking a drug that isn't covered by a particular plan. If it turns out that that's the only drug available to treat your medical condition, you can make an argument to the plan that it's medically necessary for you to get access to that drug, even if it's not on the formulary. So that's sometimes called a formulary exception. So you're asking for an exception to the fact that the drug isn't on the formulary. But you can also file an appeal if they've denied coverage for that particular drug. And the process for appeals in Medicare is different than the internal and external appeals process we were just talking about, because that's specific to insurance. So you would need to file an appeal. So I think that's the first piece, is if they don't cover it at all, looking to see, can you get a new Part D plan where the formulary for that plan does cover the drug? Can you ask for the exception request, or can you file the appeal? So those are sort of the three big options there. But then if someone's in a situation where they have a Part D plan that isn't covering their drug right now, in addition to filing those appeals, you want to think about where there are other options to offset costs for Medicare specifically. And depending on your income level, you might actually qualify for a Medicare program called the Extra Help Program or the low income subsidy. And that actually picks up a lot of the out-of-pocket costs for prescription drugs for people who qualify for that program.
Oh, that's a really great option. Going back a little bit to what you said about getting a new Part D plan. I know you and I have connected often right around open enrollment. Is that the time that someone may do that, or can they inquire about that at any time of the year?
So that generally, open enrollment is the time of year where someone who's already on Medicare can make changes to their Medicare coverage. So from October 15th to December 7th, every single year, someone who's on Medicare can decide if they want a new prescription drug plan. They can decide if they want a new Medicare Advantage plan. They can leave their Medicare Advantage plan and go back to original Medicare. That's the time to make those choices. But even if someone makes those choices on October 15th, it doesn't actually go into effect until January 1st, because Medicare is a calendar year plan. So you make the changes during open enrollment, but you have to wait for them to actually start.
Got it. Okay. Really good to know. And we had a great comment. I think Maria brought something really interesting to light that probably is confusing for many of us. She says she was fortunate when she called Cigna saying her lab wasn't in network, but luckily the rep was able to find someone in the medical group that was in network. So it took away quite a high bill. She didn't need to go through that appeals process. So she suggests always a good idea to call the insurer, but so confusing about out-of-pocket max versus deductible. Can you quickly shed a little light in terms of the difference between the two?
Absolutely. So when we talk about the key terms that people should know related to health insurance, your deductible is a fixed dollar amount that you have to pay first before your health insurance coverage kicks in. So if you have a plan, you might have a $500 deductible, or you could have a $5,000 deductible. It's going to depend on the plan that you choose. But then you might have co-payments, which are also fixed dollar amounts that you pay every time you get care. So if you're going to a primary care office, you might pay $10 to see your doctor. If you're going to a specialist, you might pay $50. Co-insurance is a percentage. It's the difference between what insurance companies pay for medical expenses and what we pay. So if you have an 80-20 co-insurance or cost share, the insurance company pays 80%, you're responsible for 20%. Your out-of-pocket maximum is actually the most important thing to know about your plan, because in a worst case scenario, it's the most you're paying out of pocket during the year for your medical care. Each plan has a different rule about how their out-of-pocket maximum works. So some plans, like marketplace plans, are required to include what you pay for your deductible, plus any co-payments that you make, plus any co-insurance amounts that you pay, that add up to help you reach your out-of-pocket maximum. And when you do, then your insurance kicks in at 100% for the rest of the year.
Got it.
Some employer plans carve things out. So they might say, oh, we're going to have a separate out-of-pocket maximum for prescription drugs, or we're not going to include the deductible in the out-of-pocket maximum. So you have to pay both the deductible and the out-of-pocket maximum separately.
Interesting. Okay. And I know you have a really great math formula when a person is deciding on insurance. And I will just say, please check back to the segment Joanna and I did last fall that covers a little bit more about choosing an insurance plan and those numbers that you need to know. She did a really fabulous job explaining all of that. So I highly recommend checking that out. But Joanna, thank you for shedding a little bit of clarity on that.
Of course. And if someone wants to kind of delve back into that, we also have an animated video called Health Insurance Basics, which is 5 minutes long, that covers that information and how out-of-pocket maximums work.
I love that. Perfect. So we'll link that as well. So going back to our questions, we talked a lot about maybe procedures, doctors' offices. If someone receives a medical bill from a hospital that they absolutely cannot pay, maybe, it was billed correctly, they got the EOB, but it's truly an amount that they just cannot afford, what does someone do in that situation?
It's definitely not uncommon. Hospital bills can be incredibly expensive. And so if someone has a bill that they can't pay, again, first step is not to ignore it. But the second step is to find out, do you qualify for that hospital's charity care program? So it might be called something different at every hospital. Some places call it just financial assistance. Some places call it ability to pay. But nonprofit hospitals under federal law are required to provide these programs based on an income level. And so if you meet those requirements for your hospital, they have to provide you with that assistance and potentially write off some of your medical bills. So that all, I know, is totally easier said than done. And it's not always obvious where to find that information based on your hospital. There is a really fantastic organization out there called $4. So the word dollar and the word FOR for, and they actually will do it for you. If you reach out to them and fill out their form, they will research your hospital's rules based on your financial situation and find out if your medical bills actually qualify for that assistance and then they'll work with the hospital to address your medical bills. So you actually don't have to do it. They will help you do it.
That's amazing. Talk about like, oh, what a needed service. So $4 is the name of the organization, for FOR.
Yes.
Wonderful. Thank you for sharing that. That's really good to know.
We love sharing resources.
Oh my gosh, resource sharing. So speaking of resource sharing, do you have any other resources to share to help people cover their costs of their actual health insurance? So we know that, we may be able to afford our health insurance until something like a cancer diagnosis happens, and then, funds really get tight. So are there other resources that can help someone pay their monthly health insurance? Is that out there for a patient?
Yes, absolutely. So at Triage Cancer, we feel really strongly that the biggest contributor to financial hardship is not having adequate health insurance. So that's why we spend time trying to teach people about how to choose a health insurance plan and then use it effectively so you can minimize your costs. But at the end of the day, you're still going to have medical bills to pay because there will be those copayments and deductibles. So at that point, then tapping into the resources that do exist can be super useful, but it's not always easy to find them. So we do have a resource on our website called cancerfinances.org, which provides education on financial topics, but there's also a module on financial assistance resources. And you can go on to that module and then choose the area of financial assistance you're looking for, and then it provides resources. But I think it's always important to keep in mind that you want to think as broadly as possible when you're thinking about financial assistance. Sometimes people get kind of focused on the fact that they need help with medical bills, so they're only seeking out help for medical bills. But if you qualify for a utility assistance program in your community, could you pay less for your utilities and be able to use that money to offset your medical bill costs? So we always say think broadly and don't sort of limit what you're looking for when looking for financial assistance resources.
I love that. Just to really think outside the box and seeing how other, like you said, pursuing other resources can help sort of shift some of those dollars around to be useful elsewhere. I love that. The website that you mentioned under Triage Cancer, is that also helpful for those that are looking to help cover costs for prescription drugs?
It does. So there's also a module on prescription drug assistance, and it talks about some of the multitude of strategies that are available, but then it also includes the pharmaceutical assistance programs that exist to help with drugs. So there is actually a chart there where you can look up the company or the drug name, and then it links directly to the assistance program that is created by that pharmaceutical company. And those programs can include things like copay assistance. Sometimes it might even be free drug based on your situation. It could be vouchers for like a 1-month trial. It can also help with appeals. So they have the information about their drugs. So if an insurance company is denying coverage for a drug, they can actually provide you with useful information that you can use in your appeal to justify why it's medically necessary you get access to that drug based on your medical condition. So they can provide a lot of sort of other useful tools. And some of them also have other types of financial assistance programs and know of other programs that they can connect you to as well.
That's great. I love that. I think, all of these resources, like you said, you pride yourself on sharing a ton of resources, and for all these different facets is so wonderful.
I think I would also go back to what you'd asked about ways to pay for health insurance premiums. Depending on the type of health insurance that you have, there might be options available to you based on your income level. So I mentioned that there's the Extra Help program that pays for prescription drugs and Medicare. There's also a program called the Medicare Savings Programs, which are actually 4 separate programs where based on your income level, it'll offset out-of-pocket costs and premiums in Medicare. And then in the marketplace, what you pay each month for a plan could be significantly reduced based on your income level. So if you have a household income between 138 and 150% of the federal poverty level, which is about $22,000 a year, you can actually find a marketplace plan for $10 or less per month. So
Wow.
that's pretty significant. So we want people to know that there are options available based on income level, but if you don't sort of proactively seek them out, you might be missing out on some of these options.
Absolutely. Absolutely. I love this. And in a space that feels really confusing and overwhelming, you do such a great job on keeping things organized so people can find what exactly they're looking for. So we appreciate that.
We certainly try.
Okay. So for those that do have medical debt, we got several questions just about how to handle that, and even questions around collections. Are there any protections related to how medical debt affects your credit? Let's start there regarding this medical debt question.
So we've actually seen a lot of movement over the last 5 years around medical debt and protections available for consumers. Some are at the federal level, some are at the state level, some are just being done by companies. So there are 3 major credit reporting companies. And those companies last year actually came out and said, we're going to treat medical debt differently when reporting it on your credit report, which impacts your credit score. And we don't really think about it, but our credit score impacts everything. It can impact our ability to get a job, whether or not we can get a cell phone account, rent an apartment, buy a home. All of those things are impacted by our credit score. And if we have large amounts of medical debt on our credit report, that's going to really impact us. And so they did some things to try to actually minimize that impact. And one of the things they did was say, you actually have a year before your medical debt is going to show up on your credit report. So instead of it immediately showing up, so it used to be 6 months and now it's a year. And then they said that if you had medical debt in the past that you've paid off, instead of it just sitting on your credit report showing up negatively that you had the debt in the past, it now gets wiped off your credit report entirely. So if it's paid off, it won't show up on your credit report anymore. And then any medical debt that's actually under $500 also won't show up on your credit report. So those were, it doesn't necessarily sound like it, but when you think about the number of people in the United States who have medical debt, this actually impacted a whole lot of people.
Good.
We also just got some news just last week that the Federal Consumer Financial Protection Bureau is actually proposing a rule that medical debt will not be used on credit reports at all to make.
Oh, that would be amazing.
It's a proposed rule, so we have to wait for the final rule to come out. When agencies put out proposed rules, they open them up for public comment, and then they come out with the final rule at some point after that. But I think that that's a pretty huge step in the right direction.
That's a huge step. And I'm sure now many of us will keep our ears peeled for when that ruling may come out, and hopefully that will be a positive one. What a great move forward.
It will certainly impact a lot of people.
Yeah, definitely. Wonderful. Okay, we got a couple last questions from our members that I wanted to cover. So regarding protections and medical debt, we had one of our members submit a question looking to see if you're not able to pay your medical bills, do they go to collections? And then do you have to pay them off in full? Following up on that, how many years back does debt go into collections? Is it ever erased?
So starting with the first question, if you don't pay your medical bills, you can absolutely be sent to collections. And we see across the country, it is not uncommon for hospitals to actually be sending patients to collections if they don't pay their bills. That's one of the reasons I started by saying you don't want to ignore them, because even if you are in a situation where you cannot pay them in full, communicating with the provider and potentially setting up a payment plan with the provider puts that collections process on hold. So providers, once you've set up a payment plan with them, will not send you to collections unless you default on those payments.
Okay.
So that's one way to keep collections at bay, is to set up that payment plan. And sometimes even, instead of you paying monthly for 5 years to pay off your bill, they'll actually accept a lump sum payment that's less than the full amount of the bill, because they'd rather get whatever they can get up front rather than trying to set up a payment plan with you over the time. So that's worth asking to see, A, if you can get a payment plan, or B, if they'd accept a lower lump sum payment. And then before you do that, making sure you don't qualify for that charity care assistance first, because then maybe the whole bill would be written off, or at least a substantial portion of it. So are a real challenge if you aren't going to pay your bills, if you don't set up those payment plans. I think a lot of people also think that bankruptcy is an easier option for dealing with medical bills. And in some cases, it is appropriate based on the size of the bill. But it doesn't always eliminate the requirement to pay the bill. So it doesn't discharge all of the debt. You may still be responsible for paying for it. And then at that point, it is definitely going to impact your credit score if you are filing bankruptcy. So it's definitely the last option that we want people to be thinking about, and sort of exhausting the options before you get there.
Yeah, that's really good to call out. We had another question that came in just about being taken to court over past medical bills, and asking if filing for bankruptcy is an option. But like you said, it sounds like you're right. That's the last possible option we'd want someone to have to take.
Exactly.
Okay. One final question just about life insurance. So we had one of our members submit a question: how can I find life insurance pro-cancer? I had insurance but unable to keep my payments going because of my chemotherapy that forced her to stop working. Any suggestions on that?
Unfortunately, when we're talking about life insurance, the pre-existing condition protections that exist in health insurance don't exist for life insurance or long-term care insurance or disability insurance. And so when you apply for those policies, those companies can require you to go through the medical underwriting process, which basically means they're going to look at your medical conditions and see if you're too risky to insure. So when we're talking about life insurance and someone who's already been diagnosed with cancer, it is more difficult to get life insurance. It's not impossible. So there are some companies that will still write policies, but you have to look at who are the companies that write policies in your state. So you have to start first with where you live, then you actually have to do some shopping as a consumer to see, because every company has their own policies about how many years from diagnosis they'll insure someone, what types of diagnoses. So it's very specific to that particular company. So you have to contact each company. So the way that you can do that is start by going to the state insurance agency for your state, and then looking for the companies that are selling policies in life insurance. And then you have to contact them to ask those questions.
Okay. Okay. Wonderful. That's really good to know. Little bit of guidance in a difficult space. Oh, we did have one more come through very briefly before we wrap up, Joanna. Should people, this came through Facebook, should people avail of FSAs?
So FSAs are effectively savings accounts where people can put money into these savings accounts pre-tax and then use those accounts to pay for their medical expenses. Flexible spending accounts are only available where an employer sets that up through your job, is how you get access to it. And it can help with things like paying your out-of-pocket expenses, but it can also pay for things like over-the-counter medications or Band-Aids or sunscreen. So it can be a useful way to pay for healthcare expenses that with those pre-tax dollars. The problem is that you have to have the money to be able to save it in these accounts. So if you don't have the money to be able to save ahead of time, then they're less useful to you, but they can be very helpful for people who are able to use them.
Yep. Okay. Just another possible option. I like that. Wonderful. Well, Joanna, thank you. This has been a wealth of information, a wealth of resources that are shared. Again, I would highly encourage everyone to go to triagecancer.org. There's lots of additional resources there, not even just about medical bills and all of the services that Triage Cancer offers, but about insurance and calculators for finding the best plan for you. It truly is an all-encompassing website of information. So we appreciate you joining us again and sharing all of this really helpful resources.
Thank you so much. It's always a pleasure talking with you.
Wonderful. Thank you. Okay, so good, right? I think we learned a little bit of everything about medical bills, and hopefully some of those resources and links and supportive information, hopefully some of that spoke to all of you. We'll definitely be including those links with this recording as well. So with that being said, I want to thank everyone for joining us for June's Ask the Experts. Please come back in July and join us. We've got some more really great segments coming your way. So we have our virtual hangout on the 10th. We will be having a workshop type segment with Dr. Tashina Reeder talking about PTSD and trauma. So how to put together a little plan for yourself. So definitely come ready to engage. And then we have our speaker series on the 11th at 6 p.m. Eastern time, talking about cancer and family and just how to manage and have those difficult conversations. So really great experts that we have joining us. All of these segments will be on our Her Library, uniteforher.org/herlibrary. And again, I just want to give one final thanks to our incredible digital education sponsors that support us each and every month. So today's Ask the Experts is presented by West, Merck, and Daiichi Sankyo, with additional support from GSK, Lilly, Gilead Sciences, and Immunogen, now part of AbbVie. So thanks so much for joining us today. Enjoy the rest of